There are a lot of factors that are kind of working against us of giving the kind of care that we'd like to give to our seniors. Oftentimes the seniors have problems that need to be addressed either at home because it's hard for them to get here, or have to be addressed very quickly because it's of urgency either medically or emotionally to them. And the way healthcare works right now is very hard to respond quickly, get people in on short notice, get someone out to their home is difficult. And care gets fragmented, and we've been thinking about ways to do better with that. Well, in the early part of this study, we did some focus groups with seniors to ask them about what was important to them. And it isn't really the way our system is built. Many of them talked, for instance, about transportation. It's really difficult for them to get to the places they want to be. And some of them talked about just help with basic things at home, shoveling the walk, raking the leaves, that sort of thing. We certainly don't have a healthcare system that takes those needs into account. And certainly the way healthcare is paid for doesn't allow for those things to be taken into account. But if we could develop a system that really linked healthcare with the community supports, I think it would really allow people to maintain their independence at home. And if there's one thing that came out of those patient interviews early, it was that staying independent, not being a burden to others, is what's really most important to the seniors in our community.
If we've been following a person for their care for several years, we know their diagnosis, we know the meds they're on, we know how they function from day to day. We may even have an idea of what their needs are as far as food or finances in their home. When an elderly person or any person goes into an emergency room, quite often they're going to get a full workup that's extremely pricey and many times not completely necessary. If this patient is one of our patients, we will have a better idea of exactly what their needs are.
It feels like we know things that we could be doing for our seniors and we're not doing them. And maybe it's just looking for as excellent healthcare that we can deliver. It seems that it almost automatically brings in these the community issues, the family support, the home support, making sure the caregivers are on the same page as the doctors and the nurses. I think we see an awful lot of waste, both in terms of financial waste when patients end up hospitalized who don't need to, but also just taxing on the patient themselves and on their families when care isn't as comprehensive as it can be. One of my patients recently, who's doing quite well and in her 90s and living alone, she said, I just wish there was somebody who could come and have a cup of tea with me. And that's the kind of thing I think that made us start looking into this project about what we could do. So, a request as simple as that really can help somebody's health when they're a frail elder.
In primary care, there's really no going home and feeling like you're finished with your job. It's always with you. There's always someone I'm thinking about. When I've been taking care of somebody for so many years, I've invested, I hate to say it, emotionally in this person. And I don't want to let it go to some other organization and not follow them through. There's a trust that's developed between the primary care provider and the patient over time. And that is a privilege on my part to be so intimately involved in someone's lives and in their family's lives.